Welcome to Rupali's channel. Today I am going to discuss a chapter from Hospital and Clinical Pharmacy for DPharm second year students. So in this particular chapter, hospitals and their organization, I am going to cover mainly the part on definition of hospital, functions of hospitals, and then classification of hospitals. So let us start. So how we will define hospitals? So see here, hospital, it is an institution of community health and its functions embrace entire spectrum of medical care, that is prevention, diagnosis, therapy, rehabilitation, education and research. What we are saying, hospital, it is an institution of community health, okay, and it will be performing several functions which will mainly cover entire spectrum of medical care, okay, and those functions will include the function of prevention, that is, for example, we can consider the function of vaccination which is carried out by the hospitals. Okay, by carrying out vaccination, here specific diseases, these are prevented. So in this way, hospital, it is engaged in the function of prevention. Then the next function, it is diagnosis. So see, whenever any sick patient arrives at any hospital, okay, before providing him therapy, what is needed, it is the exact cause behind that particular disease, that is the function of diagnosis. So within the hospital, pathology laboratories are there and many different diagnostic tools, these are utilized to carry out this function of diagnosis. So different diagnostic tools, most common one are the X-ray machine is there, okay, then ultrasound sonography machine is there, CT scan will be carried out. For more complicated cases, MRI is there, okay. So in this way, hospitals, these are engaged in the function of diagnosis. Now after the proper diagnosis, here treatment, it will be provided with the aim of restoration of the normal health of the patient. Okay, so along with the function of this rehabilitation, hospitals, these are also engaged in the function of education as well as research. So in all hospitals, they will be covering entire spectrum of the medical care, that is prevention, diagnosis, therapy, rehabilitation, education and then research. So see, hospitals which we see today, these are the modern hospitals, okay, but earlier hospitals, they just incidentally came in contact with the sick patients, okay, and they started to take the care of sick patients, okay. Initially they were run only for the homeless Sikhs, okay, they were meant for the pilgrims, wayfarers, etc., okay, but nowadays, after evolution, these hospitals, these are evoluted and we get to see the hospitals which are today, that is the modern hospitals, okay. Initially these hospitals, these were just the lodgings for the poor and needy. After that, hospitals, they started to accommodate leprosy patients. Then there was a general tendency to lump together socially depressed, physically handicapped, socially unwanted, financially weak, and the sick persons. Now, during the smallpox epidemics, these hospitals spreaded to take care of victims by inoculating them. Okay, after that particular phase was over, hospitals, they started to take care of the sick patients, okay, but they were run mainly for the homeless sick. But now today, the modern hospitals, they are taking care of patients, may it be a homeless sick or may it be a person with a home, may the patient be a poor patient or a rich patient. So hospitals, they will be providing the treatment to all different kinds and types of the patients. So here, modern hospital, it is performing several functions, such as it is taking care of patients, it is engaged in the function of education and training, it is looking after the part of research, it is concerned with the public health, etc. So here in the function of patient care, hospital, it will be providing the care to the sick and the needy patients. So here this function of patient care, it will be provided to the patient with the aim of restoration of the normal health of the patient. So here there are different several departments within the hospitals which will be engaged in this function of the patient care. Right, patient care, it will be mainly provided through the inpatient department, outpatient department, and the emergency department of the hospital. Okay, and this function of patient care, it will be carried out by the hospital with the aim of restoration of the normal health of patient. Okay, without giving any consideration to the financial status of that particular patient or to the social status of that particular patient. Okay, here same kind of care it will be provided to all the patients. Moving towards the next function, that is the education and training. So see, many of us, we think that hospitals, they will be engaged in this function of education and training only if these are attached to a medical college, but it is not so. Okay, irrespective of the fact that whether the hospital it is attached to a medical college or not, hospitals, these are engaged in the function of education. Okay, so here hospitals, they will be providing the education or training to the staff members of the hospital also. Okay, so here training programs, these will be organized, these will be arranged within the hospital, engaging the services of those which are having the knowledge and aptitude to teach. That is, those particular persons will be having sound experience, knowledge, as well as an aptitude to teach. So here we can say that hospitals, these are the workshops. Okay, here in this particular workshops, training it will be given to the staff, engaging the services of those who are having the experience, knowledge, as well as an aptitude to teach. Then hospitals, these are also engaged in the function of the research. So here medical research, it will be carried out within the hospital. So here we can say that there are two forms of research that are carried out within the hospital. Okay, one type of research, it is what for to get the knowledge about the diseases and to develop the new methods to treat them. This is one aspect. And in the second aspect, improvement of hospital services, it will be carried out through this function of the research. Then hospitals, these are also concerned with the public health. Okay, these hospitals, these will be assisting to various public health and voluntary agencies for performing the function of for example, immunization, social counseling, providing health education to the community, etc. Okay, so hospitals, this will be engaged in this function of the public health. Now, in general, we can say that these hospitals, these are raising the quality as well as general standards of the medical practice. Okay, and why it is so? It is due to the different facilities which are available within the hospital. Suppose if we need to carry out any type of surgery, then what is needed? It is an well-equipped operation theatre. Okay, and in the operation theatre, aseptic conditions will be maintained. So all these things will raise quality and general standards of medical practice. Okay, then hospitals, they will help to lower the incidence of disease through early diagnosis and treatment. Okay, depending upon the symptoms, here early diagnosis will be carried out and the proper treatment it will be provided to the patient, which will lower the incidence of disease. Okay, here hospitals, these are stimulating the growth of medical science. Doctors and nurses, they will be receiving the training in large teaching hospitals. Then these hospitals, these are acting as centers of community health, and these are contributing a great deal to the preventive and social medicine. We have discussed it just now, okay, in the function of diagnosis and treatment, prevention, diagnosis and treatment. Okay, so see, here we can say that these hospitals, these are also acting as a link between the general public and policy makers. Here bigger hospitals, these will cooperate with the smaller hospitals. Specialist hospitals, they will cooperate with general hospitals, and private hospitals, they will cooperate with public hospitals, and the whole trend it is towards the integration. Okay, so this is just about the brief introduction of hospitals. Okay, we have just looked after how these hospitals are defined. Okay, what is the history behind evolution of these hospitals, and what different types of functions these hospitals carry out. Okay, in my next video, I will be explaining about the classification of hospitals. Thank you for watching.